Well, hello and welcome to Opportunity International Australia's field briefing on COVID-19. My name is Ben Scott and I am the National Development Manager at Opportunity, and I'll be your host this evening. As we begin our time together, I want to acknowledge the traditional custodians of the country throughout Australia and recognise their continuing connection to land, waters and culture, and to pay my respects to their elders past, present and emerging. And so thank you for joining us. We're grateful for your interest, your advocacy, and for your support, and that you'd make the time to spend the next half hour with us. It almost goes without saying that this is an important time in history. This briefing will give us all insights into the latest developments in both India and Indonesia, what we're doing at Opportunity, and what we can do as a global community to rebuild in the midst of the pandemic. Over the next half hour, you will hear from our National Communications Manager, Joanne Lilly, our Indonesia Director, Simon Lynch, and our Asia Health Director, Annie Wang. So with that all-star lineup, we also have a bit of housekeeping, and we will invite you to utilise the Q&A function at the bottom of your screen. We will have some time for questions at the end of the call. So please do pop your questions into that Q&A box and we will put those to the panel. And now I will hand you over to Joanne for a update on India. Joanne.
Evening, everyone, and thank you, Ben. Meredith Scott was going to join us tonight, our CEO, but she's unfortunately not been able to join us, so she sent her apologies. But on her behalf, I would love to welcome you all again and thank you so much for joining us this evening. As many of you know, Opportunity has worked for close to 50 years addressing poverty in the developing world. Our foundations are on microfinance, that is providing small loans to people who are otherwise unable to be included in the financial services sector. But we know that there's more to poverty than a lack of money. So we utilize the reach of our microfinance network to deliver health, education, and protection from gender-based violence programs, as well as anti-trafficking programs. Our footprint currently covers Pakistan, India, Bangladesh, Indonesia, and the Philippines. Simon will later bring you up to speed on what's been happening in Indonesia, but if you've been following the news lately, you'll know it's really all about the unfolding crisis in India at the moment. Our partners are sharing their experiences with us, and this really brings home in a really impactful way the situation there. You don't have to look much further than our immediate partners and their experiences to understand the dramatic human impact that COVID-19 is having, particularly in its second and third waves. Of the 10 people that we work closely there, at least 8 have experienced COVID themselves. Many are they're fortunately recovering, but many have lost family members as well. And every time we speak to someone over there, the story is sadly repeated. When COVID started impacting the developing world in March of last year, Prime Minister Modi implemented a 9-week level 4 lockdown. And that had a huge and almost immediate impact on many of the families that we serve who couldn't afford to stock up and who lost day labor work, or the markets where they went to sell their wares were simply just shut down really quickly. At a national level, this resulted in a 24% contraction of the GDP in just one quarter. So that's one of the largest declines seen in any economy in the last 25 years. It's that precarious balance between public health and the survival of livelihoods that makes the situation particularly challenging. India suffered its first wave about 3 months ago after that national lockdown finished. And around September, when the people there were suffering around 100,000 new infections a day. At that time, it was estimated that those rates were in fact 31 times lower than the actual rates of infection. So with masks worn and other restrictions, things were okay for a while, but complacency crept in. And by January this year, people were actively encouraged to attend religious festivals, political rallies, and huge cricket matches. And that's really what gave rise to the third wave. With reported infection rates now of more than 400,000 a day, the health infrastructure that was poor to begin with is really becoming overwhelmed and in danger of collapsing. And it's really worth noting that we're talking about a country where social distancing is a luxury. It means you have enough space to be able to practice that. And hand washing is a privilege because it means you have clean running water and soap and sanitizer, which again is just not available to so many of the people in India. And we believe that the underreporting is still continuing now. If you want to be tested, the wait is around 2 weeks, by which time symptoms will probably have passed. And the other only viable option with a 6-day wait is to purchase a private test, which is at a cost of about $50 US. Again, something that the majority of the population can't afford. We've seen resilience though in our clients, but after 14 months of dealing with COVID lockdowns and the disease, they really need hope and help to restart. And this has impacted every family that we worked with and every individual. We're already seeing many more people slip below the poverty line. And this is potentially going to reverse more than 2 decades of poverty alleviation work. The impact on our 98% female client base is that they seem to have to work much harder as they balance caring responsibilities, homeschooling, and trying to make do with significantly reduced incomes. We're mindful that the rebuilding process starts now. So we're going to work to ensure that there is funding available, and we know that our microfinance services will be greatly in demand when the recovery begins, and we hope that that builds hope as things start to return in that direction. We're seeing a slight improvement in the new infection rate in the last week already, so there is hope, and we do hope that you will join us as we share a little bit more about our programs tonight and the ways that we are acting as fast as we can to assist and to provide relief for the many people in India.
Great, thank you, Jo. And for that additional context into really what we're seeing in Indonesia and our broader program footprint that Jo has introduced, I'd love to welcome now Simon Lynch, who is our Indonesia Director. Simon, are you there?
Thanks, Ben. As Jo just said, the reality is on the ground. What has been happening has been hugely understated. That is obvious in India, but I've seen it very much in Indonesia. We have had whole management teams just catch up and be wiped out, not being able to operate. We've seen people dying in car parks in the hospitals in Jakarta. When your health system and your capacity to deal with something is unable to cope, then naturally the governments aren't going to tell you everything that's going on. But we have a huge outreach in the countries that we work, and we can see through them that the staff and our clients have really been hammered. In Indonesia, there wasn't actually a widespread lockdown like there was in India. Rather, each village actually took to building fences around their village and putting guards on to stop people moving around. And it was that local initiative that actually has stopped a lot of it spreading in the really wide remote areas. I could go into a lot of the technical things that we did, but really in the brief time I have, what I want to talk to you about is what really inspired me. And that's the way our staff have adapted to the situation and responded, and the way our clients have done that, how they've adapted, how they've used their tenacity. But one of the things that many of you may not be aware of is for people living in poverty, living with daily challenges is just part and parcel of life. COVID has been massive and has had this massive effect on everybody. But in the same period, in the last couple of months, we've seen Cyclone Sejarah go through eastern Indonesia. The top left photo there is actually the head office of one of our partners, TLM. To the right is where some of our clients are over in Cebu. And down on the bottom, that photo there is an earthquake, Mamuju, over in Sulawesi, that's closed down much of the operation there for about 3 or 4 months. So I just want to make the point, I guess, that what's actually happening is something that the people there have become really good at adapting to. These challenges that come up, they are incredibly resilient. And I've been really touched by the way that the staff have personally been involved in responding. So, for example, where we've got networks either through our branches or through the churches and through the different mosques and whoever else we operate with, our staff, even though many of them have actually lost their wages because they've had to go part-time, they've still personally given out of their own money in order to give food packages, in order to get help out. They've used whatever method they could to get the information out there to overcome all of the misinformation about how COVID spread and how we protect ourselves. So we've seen them on the phones, we've seen them on motorbikes, we've seen them on the back of trucks with loudspeakers, telling people the importance of keeping distance, telling them the importance of masks, the importance of washing their hands and keeping clean. Things that they have gone totally out of their way, because these staff are from these villages, they are locals. If they weren't working for our organisations, they would be the very poor that our organisations are serving. I was contacted by one of the CEOs that was heartbroken because there was a village of farmers who were suffering from the drought there, but because of COVID, they couldn't get out and they couldn't access water, they couldn't access clients. So together, the staff actually put their money together and sent tankers of water out to these farmers. When we think about the resources we have, and I look at the staff that have so few resources and look at the way that they respond, I really am inspired by them. Similarly, though, I'm inspired by our clients. Here's a picture of Ibu Sarbara. She has quite, as you can see, a well-established stall. It's in a market called Makali. It's in Jakarta. But that market was closed down for the best part of 2.5, 3 months. So you cannot, basically you start eating your stock. But the tenacity and the ingenuity, they took it apart bit by bit and rebuilt it on the edge of the village, on the edge of town, and then basically had a drive-through where they were able to give their wares, give their products, give their fruit to people through the windows of their cars or to the motorbikes that passed. Similarly, the next slide is Ibu So Ibu and her husband were actually selling, it's a form of bakso, like a little meatball. They were doing that at Taqwa Mosque, which is in Jakarta. But again, if the mosque is shut down, their client base is shut down. So he started labouring. He's not a young man, but he will do whatever he can to start labouring. Ibu she started doing people's washing, going door to door, asking people for their washing, asking people if she could do the cleaning. But they also thought, now our business is about selling food. So what did they do? They put wheels on the edge of their stall and then moved that around, went from door to door, street to street, selling their wares there. And honestly, that's a risk. That is potentially risking their lives. But unlike us, locking down at home can actually mean starving at home. So they go out and use whatever they have at their disposal to actually connect with and re-establish their businesses. And it's why I'm confident that as we move out of this pandemic, our clients will rebuild their businesses. At the moment, I know in Indonesia, over 90% are paying back their loans because they really want to rebuild their businesses. I'll hand over to Annie now, who can tell us about the way that our health program is responding to the need. Thank you.
Great. Hi, everybody. Thank you so much for joining us. My name's Annie, and the last couple of weeks, really, we've been pivoting our core programs to really focus on the emergency response efforts in the second wave of COVID in India. And as you've already heard a bit from Joe, our emergency response strategy focuses on 5 major points, and I'll just focus on 3 of them because similarly, as you've heard on this call, we've all been very inspired by the partners, particularly serving the vulnerable communities and the families who are part of their clients and their operations. So our partners are community-based, locally led, and they've really innovated in how health services are delivered and reimagining what that looks like. Many of our partners engage in a group loan repayment model where women gather and are able to receive modules of health education. And we're trying to make sure that this trusted environment, this trusted relationship between the microfinance provider and our clients and their families is put to use to fight the rampant misinformation throughout this pandemic. We want to make sure that people feel safe, that people realize that even if they get sick, there are ways to manage symptoms to be able to get better, and really also to address the illiteracy of our clients. You can see as an example on the right is we're using conversational comics, where people dress like them, where the language is tailored to what they speak, the tone, the conversations, and also delivered in a way with their friends in a community to provide that mental health support. As many of you are probably also familiar with what we went through last year, just that ability to feel safe and to feel reassured in spite of all the news and the negativity is so core to being able to survive and endure this pandemic. On the next slide, we talk a bit about the telemedicine services that we provide right now in order to make sure that those who have mild to moderate symptoms, which we know is a vast majority of people who contract COVID, are able to access the healthcare that they need. So we provide telemedicine in 3 ways: through a phone-based hotline that's toll-free, available 24/7, through a direct mobile app from any smartphone, or through one of 336 telemedicine clinics, which you see here in front of you. And the idea is that people need choice in how they access their care. So some may prefer to use a phone because that's the technology they're most familiar with. Others who may not have access to a phone would prefer to go in person, especially if they lack that digital literacy. We know that most of these calls, and we're handling over 1,000 calls a day, are related to the psychosocial aspects of that fear, that stress, that anxiety during this period. Also, for people who have exposure to COVID or are trying to isolate at home, but as Simon said, staying at home means starving at home, we're providing food ration kits, a choice of cooked food or dry rations to make sure that families can safely isolate, particularly as governments roll out containment zones, where entire areas, especially in urban slums, are just circled off and nobody is able to leave or come in. The following slide also shows how the MFIs, the microfinance partners that we work with, are innovating to be able to deliver vaccines and drive immunity. And it's a bit tricky to think about why a financial service provider would be well positioned, but the governments are actually coming to us asking to co-brand these vaccination camps to ensure that government health workers can give jabs effectively while we're trying to mobilize the community, educating people about where they're held. And our partners combined are hoping to administer 3.5 million doses of vaccines in the next 6 months. And just for some comparison, the Australian government thus far has administered about 3 million doses of vaccines. So I just want to highlight again the incredible work that our partners are partaking in, because they really do care about the development and well-being of the families in these vulnerable communities. So I'll hand it over to Ben and would be open to any other questions during Q&A.
Yeah, fantastic. Thank you, Annie. And actually, Annie, the first question that I wanted to, I think it's probably most appropriate to put to you, how are we partnering with other organisations and government? I would say for a lot of us on the call, there's a lot of interest in making sure that we're not just duplicating effort, but also not trying to do it all in our own strength. So what does partnership look like in the health program right now?
Yeah, that's a great question, and something that we hear about quite often. So wherever possible, we are collaborating very closely to existing partners on the ground, the existing health stakeholders, and most importantly, the government. All of our health education materials are built around WHO and government guidelines The vaccination camps are done directly in partnership with government, who are actually responsible for the vaccination supply. And one thing we didn't mention is we are using both the branch offices as well as other unused facilities like convention halls, hotels, and schools, and converting them into temporary COVID care centers that are attached to rural hospitals. We know that rural hospitals are particularly overwhelmed. And so being able to tie up with them so that the extra overflow and being able to triage the most critical patients in hospitals and moderate patients in the COVID care centers, the CCCs that we're trying to establish is there. Because our partners, again, have worked for a very long time in these communities, we're not expanding geographically and entering into new communities. We're already just operating in areas where there is an established presence and established trust within the community.
Yeah, great. And I guess, Simon, is it the same beyond the health context? What does that look like in Indonesia?
Yeah, Ben, it is. Because our partners we've already got such outreach and we're already in these communities. So, we were working with the governments. The governments will do their best to provide assistance. But I'll give an example. I know they were doing some subsidies around electricity, but because a lot of our clients, vast majority of our clients are illiterate, they couldn't actually fill in the forms. So one of our partners got 10,000 of the permission from 10,000 of their clients to apply for the subsidies and get those subsidies. So a lot of it is to look at, whoever's providing, whether it be government or other not-for-profit organizations or mosques or churches, and sort of say, okay, if you want to assist, we've already got the relationships with these families and you can work with us to actually get the help into their hands.
Yeah, great to see it happening. And I think it kind of leads me to another question that we've got here. I think we've got this dynamic of, there's a government role, but then there's also the role of, the individual. Do you see the recovery, Simon, as top down or bottom up is the question?
I think the governments are doing their best to try to assist, but I don't think I think it's quite apparent that they're struggling to put the things in place, the oxygen or whatever. So really it is the communities that are the engine behind what's going to bring it back. I'll talk from an Indonesia context. They're the ones that actually took control of stopping the spread. They're the ones that are actually taking control of how they distribute food and how they look after the marginalized. And it's the clients, it's the, 3/4 of the population that run their own small businesses that in the end will start to redrive the economy and start to rebuild the economy and bring about the sort of change that's going to be needed.
Wow, 3/4, that is huge, right? It's not all completely organized operation. It's really grassroots. Annie, you mentioned the sort of mental health consequences of the pandemic. What what are we seeing the most? Are we hearing particular conditions? Is it anxiety or what are people experiencing?
Yeah, absolutely. So as I mentioned, we have the in-person telemedicine clinics, the phone-based hotlines, as well as the mobile apps. And across all three, what we're seeing is the vast majority of calls that come in. People are concerned about COVID and really require more mental health support than actual medicines or therapy-based care. A lot of the questions come in are really around how to better manage their anxiety and stress levels, especially because most of them know that they're one disease away from losing everything, one disease away from setting back the progress in this last generation for their entire household. And I think we're seeing, because of this need, we're actually reacting in terms of how our telemedicine is structured. So in the photo that I show, you'll see there was the client who's trying to access the care, the health leader, whom Opportunity has supported and trained in the last 7 years, trying to facilitate that conversation with the doctor. And so making sure that there is this community of support and that there is The ability to have support in being able to access the services that you do need is important. As Simon mentioned, something as small as being able to fill out a paper form, being able to read, being able to understand why some news sources are less trustworthy than others. The other thing that we're seeing with the phone-based hotlines is that there's an increasingly from the client's perspective that they want to know when this will end. There's been a lot of misinformation around why is there a second wave? The government said we crushed COVID-19. What do we do now? Is there any hope for us? And so where possible, we're also trying to set up with our partners, existing education around what do online job fairs look like, how can we keep the communities engaged and provide that emergency relief while also making sure that there's a pathway to rebuild their business into the future.
Yeah, great. It's interesting that misinformation that really brings that home. Thanks, Annie. And Simon, one last question. Conscious we're coming up to our half hour, and we do have a quite an extraordinary client story, family video to share. So, but we do have time for one last question. What would you say our priorities are, Simon, on the path forward from here?
There's numerous ways because of the many relationships we have that we can actually help. But I'd have to say, with just the size of the issue that is occurring in India at the moment, and our ability, as Annie has shared, to get out both from a health perspective, but also to reignite businesses, that's got to be the priority. They have 5 million clients over there. That's 5 million families. That's the population of Australia that we can get in with health, we can get in with information, we can get in with knowledge, we can get in with what they need. But then as we move out of this, in Indonesia and India and the other countries that we work in, our partners are telling us that our clients have consumed a lot of their goods. In lockdown, if you haven't got a business, you have to eat what's in your kiosk. You have to sell what you've got. So a big part of it is, okay, how can we use that hard working, that tenacity of our clients and give them the resources? And I believe if we can put the resources back into their hands in both countries, we'll be able to see them really be the engine that drives them out of this pandemic.
Yeah, great. Thank you. And I'd say for everyone on the call, I'm sure if I can speak on your behalf, you'd all agree that there's a weightiness to the current state of the world. And obviously we're in this all the time, but I think we're all hearing the same news and messages. So look, our encouragement to you is rather than be weighed down by it, we'd invite you to be part of the solution. And you may be wondering what you can do to help. It's probably no surprise that we'd invite you to give generously, and whether that's to emergency appeal or to ongoing work that is helping families across Asia to rebuild. We'd invite you to partner with us in that way. I've just popped the link in the chat for you, so you can see that there. And additionally, we'd encourage you to look at your network again. I think this has been a time for us to really reassess who can we invite to respond with us to this crisis. How can we respond at a level that's relevant to the size of the problem? Which organizations or businesses can we help mobilize together here to really change what looks like quite in many ways a bleak future for the families in Asia? And to that end, wanted to introduce you to Amina. I'm conscious we're coming right up on 8, but this is 4 minutes of just an extraordinary woman's story. And I hope you're able to join us for this. And yeah, thank you so much for your time.
My father, a tricycle driver, would come home with rice for dinner. My name is Amina, and my story is one of hope. As a child, I remember the holes in the roof dripping water during the rain and waiting to see if my father, a tricycle driver, would come home with rice for dinner. After harvest time, my parents used to pick up scraps and leftovers just to ensure we could eat. When I was in school, I remember sewing together blank pages from old notebooks because we couldn't afford school supplies.
Our special Christmas lunch was a bowl of porridge. As a family, we had to survive on $4 a day.
No matter how hard my family worked, we seemed to be trapped in a cycle of poverty. But then we discovered about the small loans available from Opportunity International Australia. Mom had an idea to start a piggery business, so we took out a loan for $123 from one of Opportunity's microfinance partners. This was enough to buy 3 pigs and begin providing a better future for me and my sister.
My university education and my professional career would never have been possible without this opportunity.
Opportunity helps families in poverty grow small businesses, earn regular incomes, and improves their access to life-changing healthcare and education. They enable people uncertain of how they will survive to have dreams and a future, like me. But across the world, the COVID-19 pandemic has devastated millions of families in vulnerable communities. Every day, they wake up to poverty, sickness, and hunger. Imagine facing this pandemic in a slum where social distancing is virtually impossible, water is contaminated, and soap is a luxury. Then imagine being locked down, unable to run the business that enables you to feed your family. Schools have been closed, and when they reopen, many children won't be able to come back. They either have to work to put food on the table, or their families simply cannot afford it. Just like with a natural disaster or war, it's what happens in the aftermath that dictates the future. With this pandemic, that time begins now. With a small loan, families can rebuild the businesses that have been devastated by COVID-19. A small loan can help them get back on their feet so they can build a better life for their families. A small loan helped my mother break the cycle of poverty in our family. It enabled us to think about life beyond our next meal, to get an education, to see a path into the future.
The dreams I had as a child became reality. I was able to finish school, get a scholarship, and go to an American university.
I can pay it forward and create the same opportunities I had for other families in need. Breaking the poverty cycle does so much more than fix a leaky roof. Not only is my parents' house now renovated, but my sister is now a preschool teacher doing a PhD. Without my mom's courage, combined with a small loan, my family's life could have been very different.
I am a living proof of what's possible with an opportunity provided by someone like you. And in the aftermath of COVID-19, families in poverty need our help now more than ever. Together, we can make an impact. But there is no we without you. To make a real difference in the world, please partner with us today.
Extraordinary. Thank you for joining us. It means a lot to be able to share our work with you, and I just want to thank you for your continued generous support. We will share this recording as well as Amina's story with you after this, so look out for that email tomorrow. But good evening and thank you.